Welcome, doctors. Let's talk about something we all feel the pressure of in healthcare: streamlining operations, and somehow making it all work without sacrificing patient care. AI has been the buzzword, right? It's everywhere, handling scheduling, reminders, even basic patient calls. But when it comes to patient triage, the first point of human contact in urgent or complex care, we made a very deliberate choice: live agents over automated systems. And honestly, this decision wasn't just about keeping that human touch. It was about safety, accuracy, and making sure patients get the right care, fast, especially when it matters most. Now, AI in healthcare call centers has come a long way. Voice bots, IVR menus, even AI triage tools, they're getting smarter. They can answer simple questions, route calls, and even book appointments. And yes, they're great for predictable, straightforward tasks. But here's the problem. Real-life triage isn't predictable. Patients don't always explain their symptoms clearly. Sometimes they ramble. Sometimes they're panicked. And that's where AI hits its limits. A live, trained triage agent can pick up on those nuances. They can hear anxiety in a patient's voice. They can ask that one extra follow-up question that changes everything, like catching whether chest pain sounds more like anxiety or a potential cardiac event. That's something no script or decision tree can truly handle. And think about emergencies. In urgent situations, every second matters. You need someone who can recognize distress, escalate immediately, and cut through the noise. Bots just don't have that emotional intelligence. They can't sense fear or confusion the way we can. There's also the reality that medical protocols change. Regulations shift. Local resources evolve. We can retrain live agents quickly. But reprogramming a bot? That takes time, and in healthcare, outdated instructions can be dangerous. And here's another thing: patients are emotional. They're scared, confused, sometimes even frustrated. A calm, empathetic voice on the other end can make all the difference. You can't script reassurance. I simply can't replicate it. Now, I want to be clear, we're not anti-automation. We use AI all the time for appointment reminders, routine FAQs, and post-visit follow-ups. But for clinical triage? For that first point of contact when patients are most vulnerable? We draw a hard line. That's human work. We've invested in training our agents in medical triage protocols, keeping them current with clinical guidelines, and equipping them with supportive. And yes, we ensure live coverage, 24/7. No, press 1 for this, frustration. The results? Faster emergency response times. Fewer misdirected calls. Happier patients. And greater trust from providers who know their patients are being screened safely and accurately. At the end of the day, AI has its place. But when a patient's health, even their life, may depend on that first call. There's no substitute for a trained human being on the other end. So, doctors, if you've been wondering whether to hand triage over to automation, here's my take: don't. Keep it human where it matters most. Your patients will thank you, and honestly, you'll sleep better knowing someone with real judgment and empathy is on the line. Thanks for watching.